The TIBU program management system was launched on Monday, 26th November at the Reef Hotel, Nyali, Mombasa. It's a beautiful Monday morning here at the Reef Hotel, where we're about to launch TIBU, a program management system that will revolutionize how we look at healthcare and especially in TB and lung diseases. The launch kicked off with speeches from key players and sponsors. Among them,
the TIBU system started last year, sometime in September, when people sat down and said, we are really suffering from this system. Just to pick a few things. This is the current system. We all know this system, where all of us walk around carrying our registers as clumsy as they look. For DTLC, he's carrying this. This is the patient card. Look at this card. What do you see? It's torn. It's pieces and bits of different colors of paper. It has been folded severally with dog ears, and that's what we have been doing. And someone said, you know what? We can make our system simpler. What can we do? Let's come up with a system that solves this tiresome process for DTLC. This system eventually will be able to show us disease distribution, age, sex distribution of disease, TB, HIV, among other things. Facility-wise, where are we having less facilities, where do we have more facilities? And also to tell us TB per province and also at the district level.
This is a journey of innovation. As we all know, you start with data collection. Then from data, when you massage this data, you move to the next level where you provide information. From that information, we generate knowledge. But ultimately, the bottom end is that we do innovation. So this is the end of the cascading of how to manage data. It will improve governance and accountability. Without governance and accountability, we cannot be able to move to the next level, because the resources available to us are resources that somebody somewhere has paid for. More often than not, it is funds that come from the government, it is funds that come from partners, and we must account for every single cent that is spent, and that those resources that are available, be it human, be it time, be it equipment, we must account for them in a very prudent and urgent manner.
We are indeed honored and privileged to be with you this morning, and I believe that as we now drive adoption of this and rollout of this service across all the various health centers and all and across the country, I believe we'll be able to achieve great impact that will result in better management and treatment of TB patients, and therefore we will have less Wanjikos and ultimately no Wanjikos having to die because of poor care. I believe we can actually be able to win the fight against debilitating diseases that can be controlled through the intervention of M-Health solutions and services that are cost-effective, scalable, and sustainable.
I'm proud to say that we have a strong commitment to work on TB issues here in Kenya, both through the TB HIV lens, but also the, I don't know how to properly say, the standalone TB system, which needs to function well if we are going to address the interactions as well, of course, as MDR-TB. So I applaud the initiative. I think it's a very interesting system. I think there are lots of interesting piloting with this system that will, I believe, probably help us learn about ways to work on the DHIS and integrated systems across the public health system in the country. And USAID is quite pleased and proud to have been able to support this effort, and I look forward to people's feedback on how it all works as it gets rolled out.
The ministry obviously cannot effectively plan with data that is unreliable, which ultimately affects provision of required logistics, leading to substandard care. This, as you are all aware, contravenes our constitution, which explicitly states that Kenyans are entitled to high-quality health care that is of the highest possible standard. To mitigate this, my ministry is embracing new and innovative ways of conducting our business that is efficient and that is cost-effective. And therefore, particularly gratified that my ministry, USAID and Safaricom, have partnered to make TIBU a unique model that specifically addresses the challenges of data management.
The TIBU system was then launched with much pomp and cheer. Reactions from those who attended the launch were favorable, with many optimistic for a brighter future in lung health care.
The term that was picked was intentional, that we are now going to treat the problems that we face when it comes to management of data in the ministry.
I think this is an excellent example of governments and private sector working together to come up with something that as the other speaker said as well, is going to make a real difference in terms of patient health, which is what we're after at the bottom line.
We're very excited that this is actually one division that has completely embraced technology.
What this system will help us do is to get timely, accurate and very reliable data.
I think this is a great thing that would solve lots of the problems that are currently affecting the TB care and control program in this country.
It is going to assist us a lot, not just in collecting data and improving patient management, but eventually it is going to assist us in improving patient outcomes.
This is local talent that we can actually bring from here to be used here to solve actual and real problems.
It was just a big day, a time to celebrate something that is proudly Kenyan, and the rest of the world can only follow suit.
Management of TB will move to higher heights, and it will be one of the best things, and I think of course we are the leading ones in Africa, and of course now we should be joining the world to be the leaders, and those people should be coming here now to borrow from Kenya and learn from us.
Many other programs should adopt it. I'm talking malaria, I'm talking HIV. Really, this system is what everyone needs.
Well, you've heard it from the professionals. This has been the launch of TIBU, a program management system. The theme of the day has been digital innovation for sustainable lung health. TIBU has clearly captured all that. Nicole Esslink from Iridium Interactive.